Hi, I'm Dr. Miner. Today we're going to talk about infant frenectomies and their role with nursing. We're going to provide some tips on how to find a provider that is knowledgeable and trained in this service. And the main providers for this are dentists, pediatricians, and ENTs. And I would estimate that about 90–95% of providers do not have the knowledge or training to provide this service. And the reason for that is we didn't get it in school. And I was in that same boat. I had to learn about this, go find a course, get knowledgeable and trained for this to be able to provide this service. And so I hope you find this helpful. So today we're going to demonstrate how to do an assessment for infant frenums. And one of the first steps is an assessment of what symptoms is the baby having, what symptoms are the mom having, because nursing should be pain-free and enjoyable. Now, tell me, what kind of symptoms are you having in your baby?
I think the first symptoms I noticed was that it was a very painful latch, and that my nipple was misshapen when he would get done eating. So and also that he was eating really frequently, short feedings, like he wasn't getting full. So he was very colicky, very unhappy. He didn't have a lot of alertness and happiness. So that was my first indication that something was wrong.
Okay. All right, so as you said, he was a little colicky. That's often misdiagnosed with colic, that it's actually a poor latch. And we'll also see babies that are also diagnosed with acid reflux, which that is very rarely the condition, that there's truly acid reflux. Both colic and acid reflux are primarily caused by a poor latch, and it's often because they're swallowing air, and they call it aerophagia. So another condition that's often misdiagnosed is thrush. They'll have a white film on their tongue, which that can be confused with thrush. But again, with thrush, that's very uncommon in babies. That most of the time that's because of the tongue tie, and that white film is dried milk because the tongue is not able to move and clean it off. All right, so to do an adequate assessment, what we're going to do is I like to put my knees up against the mom's. This could also be done on an exam table. And so we will take him and we'll just kind of spin him around here. I'm going to lay his head in my lap. And the mom will typically hold the hands there to keep him out of the way. And the first thing, we're going to look at the lip, and we just kind of push up with that. We're also going to put our finger in and feel how he latches on to a finger. And we're feeling for the tongue on if he's getting an adequate latch on that. So, and after that, we're also going to lift up on the tongue, go under the tongue, and actually look in there and see what kind of tie there is. But sometimes when we have infants come in, they've been diagnosed with thrush. And most of the time that is a misdiagnosis. Thrush can happen in infants, although it's very rare. Most of the time what it is the white film that forms on the baby's tongue, and that is from dried milk. And so the reason that forms is because the tongue is not able to move the way it needs to clear the milk off. So another couple rare things that happen in infants, but we see often misdiagnosed, is that they've been diagnosed with colic or acid reflux. While those can happen, again, that's extremely rare that it's truly the case. Colic and acid reflux symptoms are often the result of a poor latch, and hence they swallow air, which is known as aerophagia. Now there's several myths that we've run across regarding frenums and tethered tissues. And one of them is that the tissues will stretch out or they'll tear with time and not be a problem. Or in other words, it'll correct itself. We've also heard, don't worry, they'll fall, it'll tear, and be fixed. Now, trauma is never a good suggestion of how to correct something. We also hear that tethered tissues don't affect nursing. We often will hear an upper lip tie doesn't have any effect, or the tongue tie doesn't have any effect, and that's simply not true. There is a big effect that can cause a poor latch, and so infants have symptoms. With that poor latch, the mom can have symptoms that can be very painful. We also have heard that sometimes the baby can be too young to do this procedure, and that they need to wait until they're a certain age. I've heard even up to a year or two. That's simply not true. What we see and what the research shows is that the sooner these tissues are addressed, the better. Now, we've also heard that this procedure needs to be done in a hospital with general anesthesia. Nothing could be further from the truth. This is a very safe procedure. It can be done with just either no anesthetic or topical anesthetic, depending on if they use a laser. It's very safe. Now, another myth we hear is this just wait approach, where moms are told everything will be okay, you can bottle feed or do formula, but that's really not the best for the baby, because we know breast milk is the best for infants and babies. Now, there's also what's called infant sleep apnea, which is often downplayed, that there's not a role with tethered tissues, but there is. And as babies develop, they need oxygen, and when there's a lack of oxygen, this plays into a higher risk of ADD or ADHD. And so this can be when the baby's on their back, the tongue falls onto the back of the throat, and it blocks the airway some, and so they're not getting the oxygen that they need. And so tethered tissues do play a role and can play a role in that. Now, if you hear any of these myths from the provider you go to, they're not knowledgeable in this area, and you would be well advised to seek care someplace else with somebody that is knowledgeable about these. In this video, we've talked about how an assessment should be done on an infant for tethered tissues. We've talked about different myths, and now there's more to tethered tissues than just being able to nurse. Nursing facilitates how a person breathes and their facial development. A good video which explains this is by Roger Price, and it's called Front Freedom, and he talks about other factors that result in the consequences from tethered tissues. Things such as crooked teeth, inflamed tonsils and adenoids, ear infections, sleep apnea, among other things. And a good book for more information on this is SOS for Tots by Larry Kotlow. And this book goes into a lot of detail, has pictures, and talks very well about these tethered tissues. We also have moms tell us that their doctor is really only concerned about their baby as long as it's gaining weight, and that they shouldn't be concerned with the tethered tissues. Now, in discussing this, there's a lot more to tethered tissues than just if they're gaining weight, if they're able to nurse. These things, that being able to breathe right, swallow, sets the stage for how healthy they're going to be in life. And it's very important to have these addressed and have them released if needed, and set the stage for success for them.